Good morning, everyone, and welcome to the Senate Chamber. And I would like to begin by welcoming the CEO of Commonwealth Healthcare Corporation, Mr. Lazama Munya. Welcome back to the Senate Chamber, and of course to your key staff, the Mr. Warren Villagomez and Derek Sasamoto, and that lady there. I'm sorry, the HR, no? See. Welcome, Claire. And sir, I'm so sorry. You always, but Shibrodo, thank you for coming again. And my apologies. And everyone else that are here, welcome back. Today is August 25th, 2020. Here at the Senate Chamber in Capitol Hill, Saipan, and this is the budget hearing that's called by the Fiscal Affairs Committee of the Senate to get a chance to hear the presentation of CHCC's request for assistance, and also to engage with the committee and some of the information provided to the committee for this particular hearing. So I would officially call this meeting to order, and I recognize, before I recognize Jolin, I want to recognize the presence of the Special Assistant to Management and Budget, Ms. Vicky Villagomez. Welcome. Please have your seat. And Jolin, can you please call the roll to effectuate a quorum for this motion, for this meeting? Or Alexis?
Senator Francisco M. Borja, Senator Francisco Q. Cruz, Senator Jude U. Hofschneider,
Egi.
Senator Sixto K. Gisomar, Senator Justo S. Quituba, Senator Vinny F. Sablan,
Present.
Senator Teresita A. Santos. Mr. Chairman, 3 members of the Senate FA Committee are present.
Thank you, Clerk. Let the record reflect that Senators Cruz, Borja, and Santos are hereby excused from this meeting. And let the record reflect that Senator Igisomar is here, but he will be joining us momentarily. With 4 members being present, we do have a quorum to conduct this meeting. At this time, the chair recognizes any of the members to offer a motion to adopt today's meeting agenda.
Motion to adopt today's meeting agenda, Mr. Chairman.
Motion offered by Senator Sablan to adopt today's meeting agenda, please, and seconded by Senator Kitua. All those in favor of the motion, please say aye. All those opposed say nay. Motion carries. Agenda is hereby adopted. And with no objection from the members, I would skip items 4 and 5, and we go directly to new business under in this case, the FY 2021 budget hearing. And the chair hereby recognize the CEO, Ms. Munya, to go ahead and offer your opening statement, and please state your name for the record.
Esther Lizama Munya, the Chief Executive Officer. And more than ever, since January, also the consideration of a state health official for the CNMI. In the past several months, we've been really inundated with a lot of, addressing this current situation, trying to protect and contain the spread of COVID-19 here in the CNMI. I think what we have seen in the last few months shows that the integration of public health and hospital is significant. It is one of the reasons why we are, I wouldn't say, again, I've mentioned before, is that we're not doing a victory lap here, but a lot of things and a lot of the successes of how we've been handling this is really the integration of the 2 entities. There is a need to continue funding CHCC. We've been fortunate to have the ability to take and use our current revenues from the hospital to address public health. And public health has been there for the hospital to ensure to try to protect the patients as well, and to especially help with public health and treatment. So what our budget is basically targeting the same situation that what we're in now. We have to remember that the health of the community is not only CHCC's responsibility, it is the responsibility of the government. We've had issues with, non-payment of services that's provided to CHCC, but I want to emphasize that CHCC has never brought up the issue about non-payment of services or not providing services to the community. We have an obligation to make sure that our hospital remains open and that we continue to provide the services not only for hospital but also for public health. So whatever this body can do to ensure we continue to do it effectively, and to do it consistently and available to everyone, no matter who they are, whether they're residents or non-residents. That's always been the mission of CHCC. We cannot discriminate, and I hope that people understand that. And funding for CHCC needs to be adequate and sufficient to treat everyone. So that's all I want to say. Thank you. And I have my team here, as you mentioned, that are ready to respond to any questions that you have. Thank you.
Thank you, CEO. And thank you for, I apologize, I wanted to mention that in my opening statement, for all of you guys, for all that you guys are doing in leading the fight against the spread of the COVID. I know that it's a collective effort amongst all the agencies, but because this is a health emergency, it's really your lead, and I want to recognize that, as well as, of course, our good chair of COVID and administration for doing all you can. Sometimes not very popular, but it's the right thing to do, and I appreciate that on behalf of the committee and the rest of us that are listening. I'm sure the public are also share the same sentiment. So we sent a letter on behalf of the committee, and you sent back some response on the highlights, no? But if you wish to go ahead and maybe do a summarize on some of the information that you've provided the committee, say for example items 3, 4, 6, 7, and 8 of the letter, no, that I wrote to you. If you guys want to start with that to generate the discussion, please do so. Mashalji, if you want to assign anyone or recognize anyone, please go right ahead. Derek.
Thank you, Senators. So just let me go down the list. So in terms of item number 3, for a detailed breakdown of funding received to aid your office and personnel or operation expenses related to COVID. So we provided you our summary of funding that we received, not only through federal grant resources, but also funding that we received through the CARES Act as well. That's the file that was entitled COVID-19 related funding. It should be on Excel spreadsheet as well as a PDF. So in total, I believe we received about a little more than $7 million worth of grants, majority of them coming from the CDC. But on top of that, we also received some portions from the CARES Act. We received first and second round general distributions of provider relief fund, but unfortunately that provider relief funding was only about $868,000 out of the first $50 billion. We also received through the rural provider funding, which was the second round targeted distribution, $50 billion. We actually received $3.34 million from that. So in combination of those grants, that's about $5.2 million. But our total COVID expenses, even after netting out transfers to federal grants and such other sources like that, were still to the tune of over $6 million. So unfortunately, our CARES Act funding, in combination of general and targeted distributions of about 5.1, is still short about $1 million or so in terms of covering all of our COVID-related expenses. but we have transferred quite a bit of a few $1 million to federal grants in order to cover those sources and get 100% funding, because we're treating FEMA as the payer of last resort because of the local matching implications. So hopefully they lift that match, but we are still waiting, I guess, to find out on that. So
Eric, can you just qualify? I mean, for those that are unaware, the formula. Can you? Because there's some on those grants that you've provided committee. You wrote down either it's formula or competitive and all that. Can you just qualify what are those and representing? Because there's a representation that carries over from the funds that is allocated.
There was no, I think it's more about the provider payment.
yeah, in terms of the CARES Act, the formula for the first and second round distributions, unfortunately, it's kind of based on 2% of total revenue, but the main part of the formula was also based on population. So that's why, unfortunately for us, our allocations were quite low. We were hoping for more. There was other sources of funding we were hoping for, which we're actually fighting for. But essentially what we received through the provider relief funding, first and second round, when you actually apply the actual formula, it's exactly to the T 2% of audited net revenues. So they gave us the minimum of 2% of net patient revenue. And we were informed that we would not be eligible for continued funding moving forward. But through the efforts of the CEO and our team, we're actually seeking assistance with this through Congress and such, trying to get redeterminations done, or just try to see if we can we're even looking into subsection D things where we can try to get designations done for the hospital to get more funding. But that's, I guess, a little bit more high-level legislative type stuff. But we're currently working with different agencies on those types of issues.
Okay. Is there anything else that you want to cover?
Yeah, the other source of funding that we got on the report that you're seeing is the Medicare advance payments. So when you see that funding, it's about 1.2 million. There was another distribution about 700,000, so about 1.9 million. Just so you understand what that is, that's actually an advance of Medicare, which is actually a loan, which this hospital is going to have to pay back. But we had to do that in order to cover our current expenses for COVID and everything else. So like I reported in the previous House budget hearing, unfortunately we had to advance quite a bit of our revenues, especially our major sources of revenue. Medicare and Medicaid, as you know, they make up about 2/3 of all of our revenue, and we said we advanced all of that revenue for the remainder of the fiscal year way back in I believe it was April or so.
So that's pretty much covers the operating, through that's pretty much covering all what you guys been doing the last few months, or.
It's been allowing us to do so, yes, but as time moves on and expenses for the months keep coming up, because we already fronted that cash for those months, future months for the COVID response, for example, a lot of that cash is out the door. So cash is dwindling down, and it's
okay. So did you want to touch on other items there, like grants, like item number 4?
Yeah, so as you know, the grant listing is quite voluminous, so
Right.
I don't know if you have any specific questions on it, but that should be updated to show current grants as well as anticipated FY 2021 grants, and then you can see like the breakdown of when those budget periods and project periods are, so you can see how long the funding source is, I guess, projected out to.
Okay. Well, we'll drive that question as we move ahead. I think I'm going to open the floor to any of the members to ask their questions, but we'll yield to the members to pose their questions to CHC, and then I'll come back with I got a couple others that I need qualification on. So, sure. CEO.
Yes, just wanted to add on to the statement he made about advancing the funds for Medicare and also Medicaid, actually. So if you really look at what's happening in the nation, there's been a lot of hospitals. Some of the hospitals are hurting. I mean, a lot of the hospitals are hurting because of revenues. You know, people are not seeking care, and people are, or if they are seeking care, it's too late, or not too late, but late enough for us to control the expense. So, you know, you have individuals in ventilators, that's obviously going to cost a lot of money. So there's, the reason why I wanted to just chime in this is because, you know, some of the hospitals are actually, some hospitals do lay off workers, you know, because they can't pay the salaries of these workers. And these are healthcare workers that are being told to, you know, we can't pay you, so you need to, you know, to stay home. And but then some hospitals also have people that are healthcare workers that are affected by COVID. And so they need to put these individuals in quarantine, but at the same time have to have, you know, staffing, to have adequate staffing. We are in a remote island that, I mean, we are basically remote, and there's a need to keep our workers. And so our goal was to ensure that while there is the, you know, while people are hospitals are laying off workers, we obviously cannot afford to do that. We need to make sure that we have staffing available for healthcare workers, so that we can be able to handle situations like what's happening even in our neighbor. You know, that, I mean, to have 23 hospitalizations for COVID and 6 in ICU, that is difficult for us to do without the staffing. So I just want to emphasize that there was a reason for us to do that, because we need to make sure that our staffing are here and here to be readily available should there be a surge that occurs. Thank you.
Thank you, CEO. And does anybody else want to say something before I recognize them? Floor, Senator JQ.
Thank you, Chairman, and good morning, CEO and everyone who are here this morning. Thank you for explaining about the need for staff at CHCC, because my first question was supposed to be, are you planning to furlough health workers? You know, some hospitals in the States are doing it, and with the limited funding that CHCC has, thank you for clarifying that, because you answered my question before I asked it. So I was looking at the funding information for CHCC, and I really commend CHCC for, you know, its efforts in collecting and generating more revenues than before. Unfortunately, with the COVID-19, it puts us back again, especially CHCC, to a situation which is, I think, worse than before. And my question is, because of the funding situation, in addition to the COVID-19 costs, I understand that for this fiscal year, the administration is planning to transfer the medical referral to CHCC, and I looked at the information that in terms of financial impact, and it's every year the deficit of medical referral continues to grow. So if CHCC is asked to take over the medical referral funding, I think in the budget, if I'm not mistaken, I think it was proposed to give CHCC a little bit over $7 million. Is CHCC willing to accept and take over the medical referral in spite of the funding shortage and the cost of running the program?
Well, I'll tell you, there's we have mixed feelings about it. You know, obviously it's you know, the amount of money that's been given annually and the proposed funding that's being proposed is not even the same, right? So Just yesterday, we opened our oncology center at CHCC. And, that was tough decision in itself for us to do too. But, I think what I mentioned yesterday was that, we tend to look at medical referral as the solution is to get the treatment to someone else and, get everybody off island. But, for families and individuals that are visiting CHCC or any provider, the thought of medical referral is scary. The thought of medical referral means you leave your families behind. You have to make sure that they're okay. Some family members or individuals are caretakers of their parents. And it's really sad to see that we're looking at it as a way just to get the treatment out of island. This is an opportunity. For me personally, I think it's an opportunity for us to fix the system, to make sure that we have the services here. So an individual who's going to go to see it to a provider and feels that there's a lump somewhere and not hold and wait and think, well, I'm gonna wait because I'm scared to find out, because what happens to my family? What happens to individuals here? We need to think that medical referral should be something that absolutely, yes, you need to have it done. But some of the services that we can provide here, and I've said this before, please invest in healthcare here so that people don't have to worry about that. So that people can go to the clinic and say, I have a lump, I want it seen right away because I know that I am going to have the service done here, not wondering I'm going to have it done off island and think about all the additional expenses that medical referral doesn't even pay for. So that's my take on that. I think it's a great opportunity to improve healthcare, but I think you invest it in it. You need to be investing in healthcare here, as well as identifying those services that, of course, would need to go off island. But if you can minimize and really, I am just appalled at the number of deaths that we're seeing here on the island that are not even related to COVID. Every day that we report to HHS on the deaths, not related to COVID. So obviously people here are sick, and if we have the services here, that would be best. So that's my take.
Okay, thank you, CEO. And I hope that if CHCC undertakes this program, there are things that I would like to say that because I'm hearing that it's happening, and that's why one of the cost that is increasing the expenses of the program is people living in the States. They are also medically referred by our medical referral here within the hospital in the States. So yeah, I would like CHCC to look into that, and if that is really true, I'll leave it up to CHCC to look into that, and hopefully if they're living there, they should be taken care over there, and not our medical referral program handling them over there, or telling them that you can go to this hospital and we will take care of you. That's one of the things that was mentioned to me, and I hope you look into that. And also there's just too much politics going into medical referral. So I hope that if CHC takes over this program, screen out those that are politically motivated and unnecessary to be undertaken by medical referral. And I see that as factors that really puts the medical referral into deep deficit every year. And before I close my questions, I really would like to thank the COVID-19 CHCC for really trying. I think without much effort, we might probably be swarmed with positive COVID-19 people here in the CNMI, and but the much effort that's taken, I think it's helping us minimize the positive numbers that are going up. So I hope that that continues, and I also hope that if there are funding opportunities that is coming over here, which is COVID related, I hope that some of the funds be channeled to CHCC other than the grants that you are receiving through the effort of CHCC. So with that, Mr. Chairman, I will yield for now.
Thank you, Senator Kitua. Also, I'd like to welcome our good senator from the 3rd Senatorial District. Thank you. Would you like to be recognized to pose your questions, sir, now? Or okay. No, Senator Sablan.
Thank you, Chairman, and good morning to everyone that is present here in I'm in the chamber. Sorry, I get kind of choked up when I try to talk with this thing on, so I'll probably keep my distance from Senator Jude and not use the mask in posing my questions. But again, welcome to everybody, all the staff, leaders, and management of both CHCC and DPH, CEO Munya, Derek Shibrodo, and our chairman for COVID. And one more time? Claire. Yeah, I've heard a lot about you, Claire. And also, I think Jess Tudela is back there, a classmate of mine, but he's older. I'd like to welcome all of you guys, and just to lighten things up, I want to thank you. I want to thank all of you for all your, your time and effort in this whole pandemic, that has really hit us. It's really unprecedented, and I always think to myself, and you all know that I have a midwife and a nurse practitioner as a wife, and I have a daughter who is a registered nurse, and my other 3 children will probably venture into the healthcare arena, right? Because no one wants to do what I do, but I really feel it, I really see it, and I really hear it on a daily. And I just like to appreciate all your work. I mean, you guys are on the front line of this COVID-19 pandemic, in the addition to our regular hospital operations that you have to take care as well, that is non-COVID. So that's really, I frequent the hospital to pick up my wife a lot, and I see all the stuff that's going on and whatnot. So I want to give you our greatest appreciation for doing all you do for our community. I'm going to follow on our good floor leader's question on the issue or the transfer of or proposed transfer of the medical referral program back to CHCC. I know it's, at CHCC, you're probably anticipating, based on some analysis from our fiscal analyst, and then as well with some documents that you have provided us, you're anticipating an additional 17 million deficit just by taking the medical referral program into CHCC. And then also it's stated here that the CHCC has not received any details for the transfer that is proposed by the Office of the Governor. Is that still current, or has there been any information on the actual transfer and how this thing will take place? And has any data been given to the CHCC for to make that transfer more effective, more smooth? I want to ask if any of that information has been transferred to CHCC.
The answer is no.
Has there been any continuous dialogue with the Office of the Governor and meetings on such? I mean, we're about 1 month, less than 2 months away from from the beginning of the fiscal year, and I think we have to kind of, it's very vital that we look into to this information and how this will take place. Has that happened yet? No?
We've reached out, no,
Okay.
the answer is no.
Alrighty. Okay, so I asked that, so we'll try to work from our side. We have our special assistant for the management and budget here, who probably has some information on that, and maybe Ms. V, you can touch on that, and maybe to see if that data can be available to CHCC, as the proposal is looking at, I believe, this fiscal year, no, Dave, to move to make that transfer, no? To CHCC. So I think it's very, it's very vital that that information gets to you, if that's going to be the course of action in this very unprecedented time. But anything on that, Ms. V, before I ask the next question? I don't want to move on and then come back to that, but maybe if you can kind of give us some insight from the governor's office side on any meetings that you've had with the governor and the administration on the proposed transfer to CHCC.
Thank you, Senator, for that question. I was informed that there was a meeting with the CEO, with the governor, and with respect to the transfer of the medical referral, but I don't have any details that relates to any of that discussion.
Okay, so I think we'll maybe through the leadership of our health committee here in the Senate, we can look into that and probably push from our side. I just think it's important that that dialogue begins, whether we're going to do it in this next fiscal year or not. Mr. Samoto, Derek, you mentioned that the CHCC has advanced all Medicare and Medicaid revenues for the remainder of the fiscal year. Or you said for the fiscal year. This is for the remainder of 20, right? Of this fiscal year, not 20. We're not even touching 21 yet. Okay, so that answers that question there. I'm gonna move into utilities now. CEO, has there been any? I know there's some negotiations. We've had some media coverage on especially the one last week, right, with CUC's decision to to actually cut utility services to the hospital. Has there been any negotiations after that article came out that could?
My understanding is that first of all, our board found out about that through the media. Okay, so anyway, there's obviously a meeting that needs to occur, and as far as negotiations, no, we haven't paid any more than the 2.5. I'm sorry, 2 million, 2.5 million. That was paid a couple weeks ago.
So the balance now, what are we at, Derek? Like I know we were at like 32 or 33 before, and then.
Well, it's about 22, 23 million, but penalties are like about half that amount. So that 35 million includes a massive amount of penalties, almost 50% of the principal. And let's not forget that this is over 10 years. So it's not like 35 million in the last 2 years. This is over 10 years. So it's about, without penalties, it's about 2 million a year if you average it out. Yeah.
And CHCC still has the ability for backup power, right? I mean, there is backup power.
I'm gonna ask Warren maybe to chime in later on, but I just want to mention that no, the answer of using a backup power is wrong.
Yeah, no, just in general. I'm just asking in general.
Okay,
yeah,
no.
not because
That
not
is
if
in general.
CHCC is going
That
to
is
cut.
in-
I'm just asking in
yeah.
general if they do have. I mean, so just in general, not that question was
Yeah,
not
yeah.
a follow up to my
Okay,
previous
sure.
statement.
So yeah, there is a backup, but there's no backup for the backup.
Okay, I was asking that question because we did meet with CUC, and it's incumbent of us, our duties as legislators. We have to look at the kind of the whole picture, from the different angles and stuff like that. We understand the importance of all the agencies, all the departments, especially CHCC, but we cannot not look at also the importance of our utility agency and their ability to make sure that they can provide their services in order for all the other departments to provide their services. So that's why I asked that, and I apologize. I didn't mean to drive that backup question as a follow-up to my previous statement. It was just in general, so that we're comforted that there is safety for our patients. Maybe my last question for this round, and I'll try to craft more questions as we move on. I know so COVID funds, you've been able to also pay utilities on COVID funds, correct? No? You can't? So like whatever utilities you're using for COVID related operations at the hospital, COVID funding cannot pay that? Utilities? You have to use the...
Yeah, pretty much whatever's budgeted will not be covered as far as I understand. But that's definitely something that we can definitely take another look at as well. But in terms of the grants that we do have, for those that are allowed to pay utilities, we do pay the utilities for those federal grants. So we do have offices and such that do pay their utilities, but that's coming from the federal side.
Okay, but there is a possibility that COVID funds may be used or can be used upon approval or request?
As far as my understanding is no. But
No,
we
you
can
can't.
definitely take another look, but my understanding is no.
Yeah, but COVID funds can pay for personnel that are dealing with direct contact with COVID-related patients. Right, correct?
Yeah, I mean, COVID-related funds are for lost revenues or COVID-related expenses. We know that any personnel that's already budgeted, we know that it won't be covered. So it's anything in addition to whatever's not budgeted. But as we all know, I mean, the hospital operates at a shortfall every year. I mean, that's why we have these issues. I mean, that's why we have the utility issues as well. I mean, if you think about it, when we do our projections 6 months, 6 months in advance, I mean, one quarter into the fiscal year, we project out our results for the whole year. And if we know that we just are going to make it in terms of payroll and maybe covering medical supplies, I mean, what decision do we make? Do we cut providers? Do we cut services? Do we not pay medical suppliers and then pay our utility bill, which is government to government, which we hope there can be some form of support because it's government to government? And then I just wanted to point out that, it's been said in the media that, I'm not sure if it's said in the media, but it's been said that, CHCC's utility bills are being subsidized, right? For $4 million a year, about maybe $2 to $4 million a year. But CHCC has been currently is and has been and will be subsidizing the community for the tune of over $20 million every single year. So CHCC is subsidizing a massive amount of healthcare for the community, $20 million plus every year. Ask us how we survive, And if we're being subsidized for utility bills because of cash flow issues for 25% of what we subsidize or less than 25%, I would think that's a pretty decent trade-off, especially when we're talking about life and death. That's
Dirk,
how I see it.
If I may interject, just stick with the question that Senator Vinny is. We understand the frustration at times, but I ask that you stay with the question. And for the record, too, we don't take off on newspaper articles, and we just see it, but we don't necessarily take off from that and try to qualify our question based on that. That's why we're having this exchange. So, if you don't mind, no, the chair. Thank you. Go ahead, Senator.
Yeah, I'll wrap it up in a bit. Just I'm just driving questions to gain information because you guys have direct information. A lot of times, or most of the time, or all of the time, in our daily, we're expected to know all of this stuff. CHCC, CUC, everything, the whole realm of government. So when I ask questions, I'm asking it to get accurate answers so that when I answer constituents, I'm able to answer, with facts and whatnot. So I was just asking that because, if we can, of course, if we can look at using these COVID funds opposed to our funding, then I think it could save us more. Sometimes we have to think kind of outside the box and look at all these funds. But that's all I was asking, is just to kind of gain information on how what's been going on. I know, decisions have to be made, the same decisions that are going to be have to be made at CHCC with whether to decide to let go personnel. Those decisions are going to have to be made at other agencies as well. It's kind of our job to really look at the entire picture and try to strike some balance and strike some equity between all. So that's the reason why I'm asking those questions, is to gain that information, because you guys are the experts. You know what is going on there. So therefore, when people ask me as I go around, I can answer these questions very accurately and not use the media to come up with these answers. So I understand it's a lot of frustration, and trust me, like I said, I'm the daily ear for that at home, and I truly understand the frustrations of the healthcare facility, and that's the reason why here in the legislature and the Senate we try as much as possible to get all the information we can, because in the end we'll be deliberating a budget, and we need to think of all the agencies. This society is built on balance, and we need to balance out every single public assistance agency that we can, and give everybody what they need. So my apologies if I kind of stirred up anything, but I just wanted to kind of ask those questions and get accurate answers, so that when I'm asked, I'm able to answer those questions. But I'll stop for now, and I'll try to ask some more questions later. Thank you, Mr. Chairman.
Jesus Masia, Senator Vini, Senator Iggy Somar, you have the floor.
Thank you, Chairman. And CHCC, hi, welcome everybody. Sorry, we had to take care of our election commission at the same time when you walked in here. But so I was not able to gather all the documents that I needed to ask some of these questions. But didn't we pass the payer bill? Didn't that become like a public law, right? Yeah, right? So that bill was supposed to allow CHCC to tell these people to pay, right? Once you receive, generally, if I understand correctly, because I authored the bill, is the details came from you, all the details. But it was to, here we are, we have a billing. Hey, carrier, whomever you are, there's a billing here. And they said, oh, yeah, I don't like that, I don't want to pay. Oh, but that bill was saying, well, I don't care what you don't like, but the one you like, you better pay, right? That's what the bill said, generally, So we have that. And I was trying to figure out whether that was this legislature or last legislature. Lo, atan looking at Mizo accounts receivables. And this is from our analyst who did on your accounts through the audited financial statements. Olina Kalangasha Ginimagi. Oh, wait, doctor, is it okay? You speak French, right? I'm speaking French. Okay. So we are, okay, good. So there's a lot of receivables here since 2016. Can we use this act on these people to pay these bills, or did these people just disappear? I'm talking about, for example, the big ones like the carriers.
No, because the act is effective 6 months after its effective date, so there's no retroactive application. But from the last hearing we had, we qualified a lot of information regarding that report that we gave you. So there's a lot of backlogs, a lot of postings that haven't been done, and information we left in because they haven't been written off yet. But a lot of that stuff has already been allowed for and things like that. So we just wanted to present it.
So how's our AR right now? Let's say you're aging, you're 120. You're looking at what's the numbers? Pretty okay for you? I would trust what you say.
Well, we have some payers that we're currently negotiating in some past dues, but we've been quite successful lately in those negotiations. So we're still working on those as well.
So normally the ARs, they're not counted in your projected revenue, right? Because if you collect, you collect. So I'm just saying that because some of the questions we have is that, well, if this is your budget, you can be really good if you actually collect all these because they're not in the current revenue projected source.
Yes, and I'm glad you brought that up, because when you look at our revenue projection, all those adjustments are actually factored in there. That's why you'll see our revenues go from what's billable, for example, to then what's actually projected to be collected. So I'm glad you asked that.
So it's already anticipated, your collection rate or success?
Yes, but of course, just projection.
Okay, and just to go off tangent a little bit, Director, remember we were working on an insurance policy, and I know the hospital is doing an awesome job with all these payment plans and CPEs, and trying to take care of the unpaid section of these services that you're providing. But I know we went down the road, but we kind of stopped because we got the soda lord, and we had YouTube, Mancood, now we got this pandemic. But I know that we were supposed to come up with some kind of an insurance plan for our people, right? And the last proposal that we were discussing in your office and your staff was the potentially additional 6% on top of all employers to pay as a taxation, 6% additional to pay as a taxation to contribute into the healthcare plan by the hospital, so that to cover some basic needs on healthcare. So when somebody needs help, they'll pay a nominal fee, but a lot of them will be a collection. But then we ran into issues of the fact that possibly an employer already paying 6% plus another 6 is 12%. So it might be too expensive. But are we still engaging in that, Director, or have we paused it, or when can we get back on that discussion?
I think we can get back on it if you want. I think obviously our biggest challenge is funding the uncompensated care. So if we can do that, yeah.
And I'm saying that because you do have a big amount of money in the uncompensated care, and I know you're stressed out because we have to do all these things, and that's some of the things that we're hoping that works. I mean, if it's no longer the thing that works, then we need to say that it doesn't work, like this insurance plan. Similarly to CUC, discussion with CUC and with CHCC is how much can the government actually just stand up and say that, you know what, this is your cost, CUC, your cost to keeping the rates low, CHCC, this is your cost to keeping your services low. This is what I will commit to you, for example, right? If you want $10-15 million every year, here it is. It's easier said than done. But I'm just saying that it's something we need to discuss to help you out on that angle. So now, similarly, Director, I know that we've discussed a lot about medical referral. And I know that we all are aware, we all agree on the same thing. It's common sense. If only we just do not send these people overseas. If only we have all the resources to just take care of them here. So my one question is, do you like the medical referral angle plan we're going on to have you handle, or you disagree, or it depends?
It's like I mentioned earlier, it's mixed. We want it to be funded appropriately, adequately, but we also look at it as an opportunity to fix the health system.
Thank you. Because I agree with you. We've had this discussion even before we had that solar plan up, even when the power plant that we're thinking about trying to do for your hospital, the past plans we're discussing. But I really think that in all those discussions, you have great vision of what we need to do in prioritization and trying to maintain services within the CNMI. And I know I've spoken to the Director of Medical Referral who has the same vision. But somehow the problem is, as was brought up by a question on the floor, has there been any form of dialogue on these visions? I think the problem is the visions are all there. We all agree on the same thing. It's just a matter of coalescing them together to make it work. And so the only reason why I do agree, however, even though there's some great encumbrance on you with respect to the cost of you running this office, I believe that, sometimes when you do really good, right, we give you more good to do. So it's your fault. Since you're doing a great job with the hospital and with the chairman of the COVID task force, I think it's only fair that medical referral, I would agree, that the hospital handles so that we can have the proper system in place, the proper criteria to be able so that you can know what services, because you already know, but to focus these services, because the hospital is the structure that you are responsible for to be able to have these services. The medical referral is on the other side, just providing the retail services on this matter. But I think you have more power on dictating what must be built first, and that you would have more control in saying what must go and what must not go. You know what I mean, right? So that's why I'm favoring it, just so you can not get mad at me, and director. Right? Do you have any comments on that, sir?
Um, yeah, again, I just want to emphasize the need to really fund it, help us if we come up with the plan, and yes, the further conversation is definitely necessary. But I think we need to, please, just, I'm going to go back. You talk about how things are designed almost to make us fail. Back in 2012, we almost failed, right? CHCC, they stopped the funding for CHCC, and we almost failed. There was no funding given. Saying, I hope that doesn't happen again. So I hope that there's got to be a full. Don't help us by just, here it is, take care of it. We really need to change the culture of healthcare, change the way, advance the system by providing the equipment and the resources. So, again, I see it as an opportunity. It's up to this body and everyone else to be involved, really engaged in the process of transferring their referral, and not just, we'll give it to you, but, turn away and not see the end result of the outcome that we all want here. That's all.
Well, I'm saying is I understand what you're saying, because you are data driven, and I do understand what transpired in the past, and I know that whatever transpired in the past was all verbal and talk. They weren't walking it. And that's why you are in this dilemma, because some gung-ho decided to be, I was trying to put an adjective to testosterone. But anyhow, didn't you take care of the CPE, right? Right? Yes? Okay. You came up with CPE, right? I'll just say you. Yes. So that's exactly what I'm saying. See, you're data driven. You find solutions. We have a big dilemma with medical referral right now. And there's a lot of things we can't say. But Senator JQ and I and the healthcare committee have investigated medical referral. But we found a lot of things that can be taken care of and be fixed. But you are the cart dealer. You're the one with you're the limiting factor. In any chemical reaction, there's always this reagent that is the limiting factor, otherwise nothing happens. So we're all dancing around you, and I'm just saying, please be patient with us and allow us to work with this, because if you can come up with all these other solutions for the CNMI with CPE and all the others with this pandemic, I think you, as the limiting reagent to this whole solution, you can make it work. The team. It's not just about you. It's kidding. The team. Cesar Sumasi, CHCC. Thank you, Chairman, for now. I'll hold.
Thank you, Senator 62, for a very upbeat discussion and exchange. Certainly, I want to ask that you continue pushing that insurance, that we can try to figure out how to fund it. And we need to consider spreading the cost across the board, because at the end of the day, it's the only hospital that everybody goes to. Or maybe some. But it is not a session. I'm just saying that we need to continue that, and I see Mr. Shabalo's nodding yes, so he's agreeing with the statement. But before I recognize the next for the second round of the committee members, the chair would like to ask, referring back to Mr. Sasamoto's answer to Senator Sablan's inquiry of the using portion of the COVID funds to pay some of the utilities or the cost, it does allow for that. And when your entity is medical expense, such as medical expenses of public hospitals, clinics, and similar facilities. So I take that that's a general statement stating that not only your personnel, but anything in reference to the facility as well. Is that?
My understanding was utilities was not part of it, but if we did use it for utilities, then there's other medical supply and personnel COVID expenses that will not be covered. So I guess that's another decision that has to be made, whereas currently utilities are, the only utilities that we added on was really like the extra sites, the ACS and the MCATs and such like that, but we're not responsible for those. But in terms of current utilities, if there's a way to transfer those to COVID funding, that would have to be something that would have to be really analyzed because of all the other expenses, again, that we
Sure.
cannot cover, which would not be government to government. It would be private to business.
Sure.
You know, I mean, private
So-
to government. So
So with that statement, see Vicky's here. Special Assistant, can you help us answer some of these questions that we posted earlier with respect to, because of obviously the Sinema government front load the first response, just like a typhoon, no? We don't get the federal funds right away. We ask them to reimburse us because of unforeseen circumstances. So in your understanding with respect to the response, I know that you're not the the GAR for this, but I know that you're experienced with this. So is this something that's as unprecedented as it is? Is this something that is disallowed in terms of trying to maintain a level of service because of the special circumstances of having COVID response?
Are you
Because I,
referring to utilities? As in
yes.
utilities?
Yeah, because I understand that in the beginning, before the administration and the COVID task force, Chairman Warren is back, before we went down to have the alternate care site, we were, thankfully, we didn't have to treat anybody at the CHCC NALO. Anybody with asymptomatic or symptoms, they report there, no? So the committee was just requesting or asking if this is allowable in the special circumstances, out of the ordinary response. Can COVID be used to not only pay the overtime of personnel for response, can it also be used for operations, aka utilities?
So to run a hospital, you need to have power up, and for me, you know, common sense, and you know, I believe this committee also I would acknowledge that, you know, running an operation of a pandemic is, you know, huge. But I will inquire with the region and find out how, you know, operations and activities that are occurring in the hospital can be accommodated. Okay, thanks.
Okay, thank you. So, CEO and Mr. Sasmoto, Derek, is the hazardous pay on the CHCC, is everyone fall under the same category? I mean, who are the ones that are getting paid hazardous? If you can just share with the committee. Just, you don't have to say the name, but like the field of responsibility.
So from our understanding, when we discussed this with the CFO, is that, and also with FEMA, is that hazardous pay is only applicable to those that are doing the work that is not already in their salary. For example, so hazardous pay, for example, CHCC is always in the front line for services provided no matter what the infectious disease is. Whether a person comes in with TB, whether a person comes in with measles, that's more deadly. You know, those are services that we provide when someone comes in. So hazardous pay is not applicable to that, because a person who signs up for work to be in the hospital understands that that is the work. That you are supposed to be in PPEs and be able to protect yourself and protect the patient as well.
Yeah.
So that's so hazardous pay is only applicable to those individuals, for example, screeners who didn't sign up for it, you know, didn't sign up to be in front of a patient of a person who has COVID. That would be the hazard pay. So they need to
Nurses?
Not nurses. Not nurses when they are doing the regular work that they're doing. If they are doing, for example,
They go out to the tents outside to screen. That triggers.
That triggers.
So even if I'm a PA or a nurse practitioner, that I go out there to distribute or go outside my rooms of my regular duty as a
No, because you are also, so at that time, we were also paying for, what you call, no, we don't, right? No, we don't, sorry. The answer is no.
I'm sorry. Can you repeat? You kind of threw me off there.
So,
Uh,
no, the answer is no. The
The
people,
providers.
the providers, everyone that are part of their job of dealing with infectious disease already are not applicable or allowable for hazard pay. People that do not sign up for it, like I said, if we pull screeners in, those are the people that are qualified for hazard pay.
So, if I'm understanding correctly, CEO, forgive me for repeating my. So, highest level of medical providers like doctors, secondary level providers like, and and so forth, and frontliners like nurses, ERs, timan qualify no siya.
Man qualify sa man mapapasi puro inigitit sunia.
Okay.
And estatit somo puro nfoana I malongo, pues estanet somo estagagigis sa domo.
So I'm the billing and the coder, and I'm asked to go and respond. Then I qualify.
Gan.
Okay. Okay. Thank you for qualifying that. Now, I'm gonna try and make sure that I don't lose track on my line of question. But this is basically on your financial statements, and I think similar to what Senator Gisomar asked earlier. But I'm gonna ask on the collectibles, the receivables rather. Hang on, let me gather my. Okay, I'm gonna take a 5-minute recess. Okay, and we'll let me just make sure to organize. Thank you. So we're gonna begin. And CEO, I'm gonna ask regarding this year, and possibly it's gonna fall into last year's. No. For this year's bad debts, there's a spreadsheet here that says bad debts, net of recovery, charity care, that total amounting up to over almost maybe $9 million. Can you just qualify what is that?
Well, without seeing what you're looking at, bad debts and all that stuff would be.
I think this one came from you, Derek.
Yeah, I can't see the doc, but
Oh. The one that you're supposed to say is fiscal year 2020, but you guys put fiscal year 2018. It's right here, sir. It's statement of activities per fund.
yeah. Anyways, I don't need to see it. So bad debts essentially would be, for example, like it would even include like adjustments that are uncollectible. Like I'm glad you brought that up because like that AR report that you're looking at. That report contains a lot of amounts, large amounts that actually are already collected. Unfortunately, though, we're waiting for some information such as EOBs before we can distribute it out and zero it out. So in that report, you're going to see a lot of things that are just still there that actually have already been received. So I just wanted to make sure that I just qualified that as well.
Okay, but this is so we got like 3 months, no? These have as of ended April 30, 2020. So you're saying that in the last 2, 3, I can give it to you and look at it. It's right here. Search kindly. I did some orange highlight. So
This is not from their request. I think it's something else. It's not here. No, it's not here. It's a different request.
if you can just glance it and then.
Our financial statement.
So what does that represent?
Yeah, bad debts, just uncollectibles, charity care. Those would include like sliding fee, things like that. Adjustment amounts that are not collectible. For example, like VA.
Okay.
All VA payers they only pay the Medicare rate.
Okay.
So whatever they don't pay outside the Medicare rate essentially is uncollectible. We cannot go after the patient. So that would move into bad debt and
But
things
you
like
guys
that. Charity
book it there as that.
care. Oh yeah, we have to. Yes.
Okay, so with respect to the collectibles or the receivables. Um, I know that every single government employee that are with Aetna, they are paying, their employee share, and I take that even employer share. So, but it appears that there's about $8.4 million of collectibles to date. Can you share what's the challenge of collecting these things? I mean, is it billing or is it
No, if you're looking at the current year, that's actually it's being reported like that. But a lot of those amounts have already been billed, collected. Some of them are waiting EOB adjudication to determine where to spread the payments. So, like I said, that's why I qualified the report. That there's a lot of numbers in there that are being reported that actually, as time progresses, we're going to be allocating them out to where they should be. So you'll see those amounts go down. For example, you'll see some of the private payers have a large outstanding balance.
Mhm.
Those balances have actually already been settled. But because we're waiting for EOBs and such to know where to apply those payments, we have to leave it on that report because we have not applied them out yet because we're still waiting for the EOBs to determine how to apply it. So that's why we left it in there. So I just want to make sure I said that. But even with Aetna, that large amount, majority of that's already collected. But there's also amounts that are not posted yet because there's a backlog in posting. There's a mountain of work from
Yeah.
that.
So this is what I asked, like, respectfully, as CEO. Can you can you give us an update on what have been collected since? Because this is again, I'm a statement April 30, 2020, but if you are able to share to the committee how much takedown have we realized since then to your statement, Mr. Somoto? Because my next question also, there's also another provider, about $4.9 million. There's a global, I'm not sure what the Cinema Government and the global. So I'm just kind of going through down the insurance that checked in, patients that checked in, and it amounts up to like $21 million. That's substantial, and I hope that, having heard what you just said, maybe this one is down to 5 million left, no, to collect.
It definitely needs a lot of updating, that's for sure.
Okay, appreciate that, no. And if you can just go ahead and share it with Dave and the information.
That's why if you take a look at the financial statements and you look at the actual cash flow, then
Okay, appreciate it. Okay, can you run this by us? Again, forgive me for looking confused up here. I'm not. There's a lot of documents. So, with respect to cash flows, it was stated, although it's unaudited, but it was stated there was a carryover of about 5 million from previous fiscal year, and there is about 7.1 in cash right now at CHCC. And what it's reflecting here is 12.6. Is this pretty accurate? Again, this is as of April 30, 2020. Do we anticipate an increase in this? And if you average this out, what would be the numbers at the end?
well, the reason why you see an uptick in cash for that financial statement is because, like I said, we advanced our yearly revenues for the fiscal year, I believe, back in April or May. So I think that report is as of June, maybe, perhaps. So I'm not sure when that report, we advanced in March or April, I can't remember exactly, but that's why, and in our last hearing in the House, that's why I qualified that as well, because that advance of cash makes it look like we have a lot, but it's because we advanced the whole year's worth, that's why.
Okay. So I'm gonna try and articulate down what I see from the report that you provided in 2019. And for the sake of the members, and the viewing public, we're cash received from customers, and again, I'm reflecting 2019. $64 million, 237, 652. Cash payments to suppliers for goods and services, 27 million, 594, 718. Cash payments to employees for services, 38,275,535. And the net cash provided used for operating activities, negative 1.6. And then cash flows from investing activities, acquisition of capital assets is 2.378138. Net cash used for investing activities, 2.378138. Cash flows from financing activities, 2.257449. Cash received from the CNMA government, 14,705,178. Federal and other contributions received. I'm sorry, I stand corrected. Cash received from the CNMA government is 2.257449. Federal and other contributions 14.705178. Payments made under federal programs 14.279823. Settlements 173,796. Payments note payable 470,713. Interest paid on notes payable is 155,151, and that's already bracketed. So net cash provided by financing activities is 1.883146, and that's not bracketed. And then you go down the line, and this is fiscal year 2019 net increase or decrease in cash is in this case is bracketed at 2.127594, and then cash at beginning of the year is 7.650666, which brings down to a 5.523072 of that's the end of the year 2019, which you carried over in addition to the 7.143641 as reported to date as of April 30, 2020, and you add that up is 12.66713. That's pretty accurate, no, Derek? CEO?
For the financial reporting, yes.
Yes.
Based on the audit, yes. I remember our audit includes gross
Okay.
revenues.
Sure. Okay, I'm gonna yield my time for, and I'll recognize all the members to pose their question, and I have a couple more before I ask the members to eventually go on recess. But I'm gonna recognize other members to pose their question to CHC. Any Senator Kirigua, please.
Thank you, Mr. Chairman. I would like to go back to Mr. Sasamoto's comments on the questions that we should be asking him. How do you survive other than not paying CUC?
Like when you look at our financials, we unfortunately have to age payables. We have to make difficult decisions in terms of prioritization of how we spend our limited amount of cash. And of course, priority number one, if I'm off, of course, CEO will correct me, but priority number one is the health of our community. That's the driving factor, the mission. The mission versus the margin, we talk about that a lot, and it's a difficult balance, but it's a balance we have to find. And with all the issues that we're facing that are out of our control, that's why we come and seek support. But it's a lot of prioritization, and unfortunately some obligations, like you said, that we cannot meet even though we want to meet those obligations. So yeah, it's just a balancing act pretty much.
I think as he was talking about that, I was thinking about our staff. I think our staff has been really, there's a lot of people here that really, really commit to a lot of things. And they, a lot of our nurses, even our nurses and our have not gotten, an increase for quite a while. And we're losing some of them to our neighboring islands and even the U.S. So we survive with the commitment of everyone, everyone not understanding that sometimes we have to wait. But like cancer, you don't want to delay it too long. You're going to lose it. So that's, we come here every year and we ask for help, and we sometimes know already the result. The outcome is no help. And, but we know that, and the staff kind of recognizes that we have to be the ones to take on and make things happen. And I gotta recognize a lot of our staff that are really out there, patiently waiting and hoping that someday, there's gonna be something that's better for them, but, it requires a lot of their support as well. So that's how we survive.
Well, thank you, CEO. Does CHCC pay the 1% to the public auditor?
Fortunately, we've been exempt from that for the last few years, but I think for the current fiscal year, I don't believe we are exempt, but that's another thing. That's reverting resources from medical expense to funding that agency. I don't know if it matters, but I think they have a overage every year, so I don't know. But it's going to be another difficult decision for us again to divert money away from medical operational expense, for example.
So CEO, do you recommend that the legislature in the 21 budget suspend the contribution of 1% to public auditor?
Yes.
Okay, thank you. On your report, you indicated here that there's an amount of over 200,000 that is due from the CNMI. Is this from? Have you have not received this due amount from the CNMI?
Yeah, unfortunately, fortunately we got that support of 2.5 million, but there are some things that were mandated, for example, like in the previous Budget Act, Public Law 2110, for example, Public Law 18-71, some other public laws, even the FY19 and FY18 Budget Act that actually mandates how certain funding will flow for CHCC, but it has not happened and we have not received the funding. So unfortunately, yeah.
Okay, thank you, Mr. Samoto. Mr. Chairman, I will yield for now.
Thank you very much. Our chairman is out at the moment, but as the vice chair, I will take over the floor. But for now, I have a question for OMB. Ms. Vicky, if you don't mind, CHCC has identified the gaps between their operations, most especially the services that they're provided that are unfunded liabilities. And also, I notice we also have a Department of Corrections liability. Do we, just from you, do we plan to pay these? I mean, I know it's not a trick question. I'm just wondering if there's things you have maybe discussed or that you may know to share to give them comfort, or is this for the legislature to act on? Because I know you worked on the budget asking us, helping the government administration based on your prioritization, what we should pay or not pay.
Thank you, Senator. So the agency that provides the services should provide a bill for collection to the agency that received the service. I don't know if that happened, but if it was an expenditure that was incurred by the Department of Corrections providing care to the inmates, then yes, somebody has to pay for that. So it's I know that in every budget allocation that we place under the CHCC subsidy or CHCC, we indicate in the communication that a certain amount up to 250,000 is to be reserved for medical care for inmates, and I'm not sure if Department of Corrections has paid CHCC. More than likely not, because the CFO is nodding no. But it is an obligation that the department, if they receive the service, should pay the agency that provided the service.
Thank you. I do understand. I'm actually grateful for CHCC for providing the care. I've visited the correction many times, and I do advocate a lot that we take care of them, visiting the people that work there and the inmates there, just trying to see how they are. And as you know, since Affordable Care Act, it's always about affordability, accessibility, and availability of care to people. And the people, inmates, are not to be separated. They also must get the care. And we do have, we have discussed that, yes, they must go whether they pay or not. But the fact that it's providing an encumbrance on you, on the liability aspect of financial services provided, I think, as our OMB is saying, let's see how we can let's test it out. Send that bill to correction and say, I need it tomorrow, and send it to court and have whatever. But somebody has to pay. And I'm only asking that because it's a liability that's popping up, and it's something that we need to consider. And it's not the only one. Also, OMB on the governor's budget to us request CHCC is zero funded for request, right? A request of budget for the hospital. They're asking for 33 million. The budget from the governor is saying zero. Am I correct?
I think the allocation for the hospital that we provided was only transferring the medical referral of that $4.4 million. That's what we provided.
Okay. So, not to be facetious or sarcastic, so they're asking for 33 million. We're giving them a liability of up to 30 million, and then we're going to give them 4 million. So it's okay, right? But anyhow, so we need to, so I'm saying that it's creating, because, as much as we're trying to look for funds for our government to try and take care of our departments, we're trying to identify additional $12 million or $20 million on top of the current budget request of the governor. Then we have a $33 million deficit on the CHCC that we try to care for. And of course, education and healthcare is high priority, so we need to figure out how to take care of that. And so for you, CHCC, if you don't get this 33 million, you have accounts payables. And I noticed that we've asked a lot about your operations and accounts receivables. What is your aging on your accounts payable like? What's the pending, $2-3 million?
Oh, the quantity for the current
value,
year?
dollar value for this year pending that you have not paid. Because you said that you've been just playing ping pong with your payables.
Oh, in terms of payables.
Yes.
Wow. We're okay in terms of most vendor payables. We eventually catch up, but I do receive communications regarding, we need payment, but we definitely try to make sure we prioritize that because it's directly related to providing services.
Okay. So let me back up. Is it okay, Senators, if I continue? Let me back up and use the CUC as an example. You mentioned that the $33 million value on that CUC is a really old account, about 20-some million at 10 for the late fee CUC is adding you up to 33. But currently, you're paying CUC monthly, or your budget of $4 million, that's actually your annual usage of utility, just $4 million?
For the current fiscal year, the only payments made were the recent $2.5 million that was transferred over. But other than federal grant payments.
So on CUC payment current, what's your current with CUC, not counting the back years? Are you currently up to par with CUC within $1,000, or we're talking $1 million of unpaid payable to them because of your challenge?
Currently, if I'm not mistaken, we are current with that 2.5 million payment.
And thank you. I'm saying that because the legislators, I hope the House understands, the Senate understands, that the fact that we have about $20-some million of service of CUC utility that's unpaid for, that's an FAC inclusive in there, that is going to be creating a huge burden on the people as well. So I hope we are able to figure this out before it balloons into an increase of utility rates, which we don't want to take care of. So thank you on that. I was going to ask another question of how you're going to survive, but I think you already answered that. And I hope we find the solutions to give you some funds. I hope we are successful. There are things the Senate can't do. we cannot appropriate money as far as laws, introduce bills. We can only communicate with the House to put some of the initiatives into play to allow us to be able to have funds. So we hope we can succeed in working closely with the House and the Governor to find for additional revenue so that we can take care of the hospital with your deficit of about $33 million. So any other senator who has comments? Senator JQ, floor is yours.
Well, thank you, Vice. This is something to be thinking about. It's good that Mrs. Villagomez is here. And I think our Washington delegate is working on it too, to try and allow our government to borrow under the CDBG up to $93 million. And perhaps if that ever materialize, that some of the funding probably should be allocated to CHCC, at least to pay up for some of the utility bills that are still outstanding. And I don't know how that's going to be divided. I hope that it comes to the legislature so the legislature can appropriate the funds or the funding allocations to whatever is outstanding within our government. So that's something to think about in the future. Thank you.
Thank you. And if no comments, further comments from the senators, I will move towards the direction of calling a recess, but then I will ask the CHCC if they have any further comments. However, what the comment I would like to make is for clarification. I work a lot with the hospital, and sometimes I guess people may misunderstand my position or my comments, thinking that I'm out of whack, and I apologize as well because I become unprofessional sometime in talking too common with our director and the CEO. But I want to say that, things just don't happen at the hospital just by the CEO herself. I do want to recognize the entire staff of the hospital, partners and team of the hospital. Without you, I don't think Esther can be shining up here. And as they said, if you want to conquer a hill, if the leader stands there and says, let's go for it, and everybody else waits for the leader, then that's not good. But if the leader says, let's take that hill down, and everybody runs up there before she does, then that's great. And I'm saying that's the kind of leader you have. And the other scenario is, a great leader when people in the hospital are saying, oh my God, we are being attacked in every direction. And she stands up and says, awesome, now let's fight in every direction. And I believe that that's the kind of leader you have, and that's why I have faith in her with her data, her CEO, advisors, and all the specialists she has to be able to find solutions for us with respect to this medical referral, the Medicaid issue that we have, and the challenges that are in our community. So before I end and ask them for last comment, Senator Jake, do you have any last comment, or Senator Sablan? Malika? Well, before we adjourn, CEO, any comment, last words from you and to our team?
I emphasize that this is the issue is CUC and CHCC. We provide services. We don't think about, are we going to get paid? We do it because we know it's necessary. We've tried to sit down and make an offer of what can we pay CUC, but, and I'm bringing that up because I know it keeps coming up in this forum today, but, there's some people that come in and they come in with maybe only a dollar medicine that they need. Some people come in with $20,000 cost of medicine. That's a decision that we have to make. And yes, sometimes we look at it and say, CUC, we need to wait. So help us make the decisions easier. If you can do that for us, that'd be great, so that we don't have to choose between CUC and providing care to the patient. Thank you.
Thank you, Bidford. Awesome words. So, did you make a motion, Senator Jakey? What was the motion? Move to adjourn? Second? All in favor say aye. Aye. Motion carried. Thank you very much. Just Mossy CHCC and team. Thank you.